Good morning, everyone, and happy holidays. I'm John Simoins, and I'm here for Protect Our Care New Hampshire. And today we're here to catch you up on the fast-breaking news around the Affordable Care Act and open enrollment for 2026. Just before I introduce my panel, quickly, yesterday, not the New Hampshire, sorry, the U.S. House of Representatives passed a Republican health care bill that did not renew the Enhanced Affordable Care Act premium tax credits. Those are set now to expire at the end of the year. There is some good news. According to the latest CMS reports, nearly 5.8 million people have picked a marketplace plan for 2026, which is ahead of last year's pace at this same point. So open enrollment continues through January 15th, 2026, but the landscape remains uncertain until Congress decides whether to extend the tax credits or act retroactively, which will shape premiums and coverage rates for millions for 2026. And I remind you that over 70,000 people here in New Hampshire get their health care through the Affordable Care Act in terms of the exchange. So without further ado, let me introduce my panelists for today. We have Senator Cindy Rosenwald, who is from New Hampshire District 13. We have Phil Sletten, who is the research director for the New Hampshire Fiscal Policy Institute. And finally, we're really happy to welcome Representative Lucy Weber from the New Hampshire House, Cheshire 1. Thank you all for being here. I would like to start with Senator Rosenwald and ask a simple question that probably has a complex answer. Um, what did the Republicans vote to do in Washington last night? And why is this such a consequential decision for New Hampshire families? And basically, what warnings were ignored before this vote took place? Senator, thank you for being here. And be sure to take your mute off, obviously.
Thanks
There you go.
for having me. Um, I think really what is critical about what the Congress voted to do last night was what they didn't vote to do, and that was to continue the um, premium, the extra premium tax credits. And we've known for a couple months that when January 1st comes around, as it will, and those enhanced premium tax credits expire, on average, cost of health insurance premiums will more than double. On average, they will increase by 114%. And in New Hampshire, that's going to affect more than 47,000 people who buy their health insurance on the marketplace, the health benefit exchange. So their families are going to be forced to make some very difficult choices, such as do they keep the heat on or do they continue to purchase health insurance or go without insurance? And just for a couple of examples, a single person in the mid 40s in New Hampshire who earns just over $31,000 a year could see their annual premiums increase by over $1,300. And as you know, the older you get, the more expensive health insurance becomes because age is one of the few areas where the insurance companies can rate consumers on the exchange. So a couple in their 60s, too young for Medicare, earning $90,000 annually, they could see their premiums increase by close to $15,000 a year. That's just completely unaffordable. And we've been told this was going to happen. Um, on, and as bad as all of this is, the HR1 OBBB could put the Medicaid for 46,000 Granite staters in jeopardy. And to the extent that people lose Medicaid coverage and still get care, that just puts additional pressure on commercial insurance premiums. So if fewer people are on Medicaid, people with commercial insurance will end up picking up the tab.
Thank you, Senator. And I mean, just for your own knowledge, my I get my health care through the Affordable Care Act, and our premium on the same plan for last year and next year will increase by doubling almost, just a few hundred
Mhm.
dollars less than it is very surprising. We're going to downgrade to a silver plan from a gold plan. But my follow-up quick question to you is, so a few Republicans broke with their party last night to push for a vote to be held in early January once again on these tax subsidies. Now they will have expired at that point. From your perspective, what's the chance of something positive happening with that vote in January?
Well, I um, don't think of myself as a good prognosticator,
Well, better
but
than me.
I think even if some extension of the subsidies and what that might look like is concerning as well, because some parts of the Republican House caucus have been talking about putting abortion restrictions into any extension of the tax subsidies. But I think the chance of getting to 51 votes in the Senate is pretty slim. So I think it's much more likely than not that those enhanced premium tax credits will expire. And the president has talked about sending out $2,000 checks to people. That is just not going to work. The way insurance lowers your cost to the extent it does is that you're in a pool buying insurance with a whole lot of other people. If you're out there on your own trying to negotiate with providers, you're going to be paying the full charge, which people with insurance don't pay. So it's just going to make their cost of care even more expensive, and it will not actually help them pay for care.
Well, thank you. Thank you for that analysis. And speaking of analysis, Phil, it's good to see you again. I want to compliment the Fiscal Policy Institute released a really comprehensive report not long ago about what the average New Hampshire family is facing and how their budget breaks down in terms of expenses. So based on those numbers, which were widely reported, and it was good to see the media pay attention to that, what did the data tell us about how many Granite staters will be affected by the lack of these tax subsidies and by the increasing premiums? And I don't know if you could also give us an idea of how much premiums are expected to rise if these tax credits are not reinstated.
Yeah, and I think it's very important to put what we're seeing in the coming year, if these tax credits are not reinstated or brought back in some form, in the context of what we've seen families in New Hampshire face when it comes to rising healthcare prices over the last 2 decades. Part of our research, we found that alongside housing costs and the costs of childcare, early care, and education, we see that healthcare costs have increased among the fastest of the typical expenses that a household faces in New Hampshire. The premiums, especially the premiums, if you look on the employer-employee side in terms of where people can access coverage through their employer. If you take the cost in 2024 in New Hampshire, the average cost of a premium for a family, that cost is about $26,000 for the employer and the employee combined. That means that you could essentially buy a new car, right? A new Honda Civic or a new Subaru Crosstrek every year for the cost of the health insurance premium. And that health insurance premium is not including the cost of anything going wrong, right? No one's getting sick at that point. No one's paying the out-of-pocket components. That's just to maintain the coverage. So we know that health costs have gone up and been significant, including out-of-pocket costs for families in New Hampshire and for employers in New Hampshire. And I think it's important to remember in the context of these tax credits the purpose that they had in the original Patient Protection and Affordable Care Act. When they passed in 2010, why were these part of the law? And they're part of the law because there was an expansion of Medicaid to cover people with very low incomes. And there were more ways to try and control costs and bend the cost curve, if you will, on both the employer side and the non-employer side. These tax credits were designed to help people who either didn't have access to coverage through their employer and weren't didn't have low enough incomes to qualify for expanded Medicaid or qualify for the expansions of Medicaid under the Patient Protection and Affordable Care Act, but would still have trouble affording health insurance on their own, right? So it's designed to help individuals who didn't have coverage through their employer for whatever reason, maybe their employer didn't offer it, and weren't otherwise eligible for publicly subsidized or publicly funded coverage. So when we're thinking about who's going to be impacted if these tax subsidies are tax credits are not extended, and let's think about that group. Now, what are these extensions? These are beyond what we saw in the original Patient Protection and Affordable Care Act. These are expansions to the tax credits that were included in the American Rescue Plan Act and included for 2 years there, and then extended for 2 years under the Inflation Reduction Act. So to the earlier conversation of we knew this was coming, right? Senator Rosenwald pointed that out. This expiration date has been on the calendar for some time. And these increases, should they come, are on top of those increases that we already see in underlying healthcare costs that households are facing. And there's obviously when there's a flow of money into the system that is reduced or is cut off, that we could see from the tax credits expiring, that can push up costs throughout healthcare.
Phil, thank you. And as a follow-up, based on your research, we're seeing changes to the Medicaid program in New Hampshire. Now we're seeing perhaps a drop in people who are enrolled through the Affordable Care Act's exchange. Talk to us about what you see, what the numbers tell us that's going to do to rural healthcare in our state, rural communities with clinics or hospitals. Where's the impact going to be in rural New Hampshire, which is, by the way, half the population of the state, I believe, lives in rural areas.
Mhm. Yeah, so the one of the things that we see in some rural parts of the state is a higher concentration of enrollees who are on Medicaid in terms of who shows up and needs care at a healthcare provider or a hospital. And those, first, there's constraints on the Medicaid program that mean that some people may be disenrolled. So the One Big Beautiful Bill Act that was signed into law on July 4th included, for example, Medicaid work requirements, but also additional paperwork associated with redeterminations. Some people lose their coverage outright, particularly refugees, asylees, and certain other people who are here in the country legally but are immigrants, relatively recent immigrants to the country. So we see some outright coverage losses, and we see that there's likely going to be coverage losses from some of these other changes to the Medicaid program. That means that those individuals who were previously on Medicaid may have trouble accessing Medicaid. That's a potentially lower reimbursement for healthcare providers if someone shows up without coverage. And that means that, again, there's not that federal money flowing into the system from the federal government and helping what we see, the cost that healthcare providers see in New Hampshire, including in rural parts of the state. Now, there is one more change to the One Big Beautiful Bill Act made that limits provider taxes, and that would limit our Medicaid enhancement tax in New Hampshire in particular. And that means that providers in the state, particularly hospitals, there may be some policy changes associated with how hospitals are reimbursed for covering people who either don't have health coverage at all or who are on Medicaid. And that could amount to hundreds of millions of dollars a year relatively easily starting in 2029 and then being fully phased in by 2031 and extending over the next 10 years. The One Big Beautiful Bill Act may result in about a $3 billion less in the Medicaid program in New Hampshire over that 10-year window. And that's essentially like losing a funding for a year or even a year and a half of Medicaid in New Hampshire, again, depending on what happens with healthcare costs overall over this time period. So there are, I think, significant risks to rural providers that may have a larger share of their population currently on Medicaid because the ways in which the Medicaid program both keeps people enrolled and also is funded are changing in the coming years.
Well, that is a lot to think about, Phil. Thank you.
Mhm.
I want to, speaking of rural areas, I want to now switch to Representative Weber. Thank you for being here. So you represent a mostly rural district. What does this mean for families in your district and across the state? Is premiums double or in some cases more than double? And how do those higher premiums translate into medical debts, skip care, or lost coverage?
Well, good morning, and thank you all for being here today, and thank you for having me. And I would just note that I have been through two redistrictings in my time in the House, so I now represent Cheshire 5, which as opposed to Cheshire 1, which was my last district, and before that it was Cheshire 2. But I currently represent the towns of Surrey and Walpole's the big town, and it has somewhere under 4,000 people in it, so it's pretty rural. Um, and so the consequences for my district are mind-boggling. First, on an individual level, people are going to be unable to absorb the higher costs into their already strained family budgets. And so, as we've said, a number of people will choose to go without health care coverage. Without coverage or with higher copays, they will skip routine health maintenance appointments. And as a result, they're going to miss treatment for chronic conditions, both physical and mental. They'll also miss the opportunity for early diagnosis of new conditions, all of which are categorically treated more easily at less cost when they're caught at the earliest possible stage. And that's good for the health of the individuals, but there's a lot of domino effect going forward. Um, Folks will show up at emergency rooms when they're much sicker, often with preventable illness. The emergency rooms have to order treatment regardless of insurance status or ability to pay, at least on a limited basis, but this is an exceedingly costly and inefficient way to deliver health care. And our emergency rooms, as anyone who's visited one lately knows, are already stretched to their limits. So for the individual, it simply means that overall, they may be less healthy going forward. And in addition, it also means that for treatment in emergency rooms or emergency hospitalizations, there's the looming specter of crushing medical debt, even to the point of bankruptcy. And for our hardworking citizens, this is a crushing burden. We keep hearing messages about the problem with the system as freeloaders. And I would be the first to concede that there are some freeloaders, there are some Medicaid fraud, but it's minuscule, absolutely minuscule. And in order to address that, we seem to be putting unspeakable burdens on people who go to work, pay their taxes, and just want to keep their families healthy. But there are real consequences beyond the individual. So, secondly, as we know, we're in the middle of a workforce crisis in so many different fields in this state. And this shift is going to result in a less healthy workforce. We don't know to what extent yet, but that's going to be more absences and some folks who will wind up having to leave the workforce entirely. And that's going to contribute to even more gaps and leaving businesses with a shrinking pool of available workers. So that is not something that I'm looking forward to when I need to get my car repaired. Um, Third, and I think this is one of the things because I serve as the ranking member of the Health, Human Services, and Elderly Affairs Committee in the House, is the one that I think about a lot, is the effect on our healthcare institutions all across the board, all of them. And what I want to emphasize is that the changes that we're talking about specifically today are not happening in a vacuum. There are a lot of changes, and I think both the previous speakers referred to this, but there are a lot of changes, all of which interact. And our healthcare institutions, as a result, are in the midst of a perfect storm. So consider, for example, in my area, Cheshire County, on the Connecticut River Valley, the departure of every Medicare Advantage program for our state, except for the programs offered by Humana. And that's something that people in my age range are grappling with, as opposed to people who are dealing with the um, exchange issues. But for institutions, these all get added together. And in my part of the state, most of my constituents, like me, get their health care from the local healthcare clinic in Walpole, which has 2 nurse practitioners, or for Cheshire Center in Keene and its affiliated doctors there. And for more serious conditions, they require that they have to make a trip up to Dartmouth Medical Center in Hanover. It used to be in Hanover. It's been in Lebanon for 40 years, but it's hard for me to change that speech pattern. Um, and every single one of those practices are out of network for Humana. So that means that if you want to go there, you're going to pay who knows how much increased cost. So you couple those and any number of other forces that I haven't gone into. The net result is considerable new strains on emergency rooms, considerably more uncompensated care provided by our healthcare institutions. And that's not only at our hospitals, but uncompensated care for other institutions like our community mental health centers, who are already providing a significant amount of uncompensated care. And I hear in the legislature every year about how they are stretched to their utter limit and how they are doing the most creative things they can possibly think of to ensure that people who have chronic conditions maintain their medications, maintain their appointments, maintain their equilibrium, keep in the workforce, and don't go spinning out of controls and wind up either in a mental hospital or in jail, which is the other consequence that happens fairly regularly there. Um, so all of these institutions are already stretched to the very limit, and we've already seen closings like the Franconia Healthcare Center, and we're going to see more. And what that means for everybody else, and I think we've touched on this already, is that even folks who retain healthcare coverage will have fewer options available to them than they have now, not to mention the fact that if you have conventional health insurance, those premiums are going to go up because costs are going to be shifted to them. And each successive loss puts more strain on the remaining institutions, and that keeps us in a vicious cycle. And that is worrying me a lot these days. The other thing I just wanted to say as a follow-up to the mention of the OBBB Medicare work requirements is that I want to make it very clear that the real risk there is not that people who aren't working won't have health care. The risk is that the 75% or greater of those people who actually are working are absolutely categorically qualified for the coverage, but because of the verification requirements that they are going to have, which require things like computer literacy, access to a computer, access to broadband connections, and other things like that, they may simply not, by virtue of the fact that life is hard and they've got a lot of stuff on their plate, not be able to fulfill the verification requirements. And therefore, although fully qualified and working, they may lose their coverage anyway. And that is just a tragedy. So I just wanted to make sure that that was added into the mix here. although it's a tangential issue.
Well, thank you. I really appreciate your going to depth and looking at your district, but people across the state. My colleague Rachel is here, and Rachel, do we have any other further questions for our panel?
Yes, thank you, John, and thank you everybody for joining us today. If any of our press on today's call have questions for our speakers, I invite you to drop those at the in the chat function at the bottom of your screen, the Q&A function. Um, and we do have a question that was submitted ahead of time by someone who couldn't make it today. That question is for for the whole panel. How soon will families in New Hampshire feel these premium cost increases?
January, right?
Yeah, these are these credits are designed to help people with their monthly premiums. So those cost increases could come in as soon as January. And I think it's worth noting as well that if we look at how at survey data that's available and as to how people might respond to these cost increases, some families, at least a national survey from KFF, the organization that used to be called the Kaiser Family Foundation, it's a healthcare analysis firm, they surveyed nationally and found that for those whose health insurance costs would double, about 1 in 3 said they would very likely shop for a lower premium plan. Now, that period is sort of already over in terms of the shopping period, unless it were to be reopened by Congress if they were to change the law. And about 1 in 4 said they would likely go uninsured. Now, that 1 in 4 may not show up right away, right? That might not all show up in January, but as people are trying to factor in how do these increased costs fit into my family budget or don't fit into my budget, that could increase disenrollments over time. And that could be on a month-by-month basis as people are facing that bill and not able to make it. So we may not see all of that increase in people being disenrolled in January, but the cost should start showing up for families pretty soon in the new year.
And then I would just say that the societal costs, the workforce costs, the institutional costs will pile up going forward, but they will take much longer. They will take much longer to show up. But for example, the next time your healthcare policy, conventional healthcare policy, gets renegotiated, you're going to see added costs added in there that you didn't incur, but they're going to affect you. And you're also going to see, I mean, I have most of the medical appointments that are just routine, blah, plain old medical appointments like a mammogram, 4 months out, 5 months out, 6 months out to schedule. Dermatological exams have to be scheduled when you leave the last one for next year. And if you miss next year, you're going to schedule for the year after that. And those are going to get worse. And they're already at what I would think of as unacceptable levels, but you're going to see more of that.
I agree, because I think what we're not considering is that as people drop to a lower insurance level on the exchange, they will have a higher deductible. To the extent that they're not able to pay those bills, it's the providers who are going to suffer. And we're likely to see staffing cuts and program cuts that, as Representative Weber said, will make access to care just that much harder.
And the deductible issue is a real issue as well, because if you have a minor complaint, you're less likely then to address the minor complaint. And if it was truly minor, well, it'll get better by itself. But if it was the precursor of something that was much more major, what we what we would like to see people be able to do is feel that they can call their local practitioner, who they can see at the lowest cost point, and get it taken care of quickly so that it doesn't evolve into anything else. And, that's true at the level of, just a respiratory infection or a cancer care or anything else. easier, quicker, cheaper, and just better for people in general to get the care early and get it taken care of. And also the ongoing, I just want to flag once again, the ongoing issue of chronic care and making sure that people with chronic conditions have them managed. And I can remember Governor Hassan talking about when these credits came into effect, talking about the effect on one woman she spoke to who had literally been out of the workforce for 10 years, had massive infections and healthcare issues, all of which were actually able to be treated once she had coverage. And after a 10-year hiatus, she started back into the workforce on a part-time basis and eventually was employed full-time and had insurance company through her employer, which is what we'd really like to see anyway. So, yay, we get one more person added to the workforce. We have completely turned around the life of somebody who had for 10 years been suffering. And it's just such a win-win and such a short-sighted change to make, both for individuals and for our society as a whole.
I think it also means that we have more and more Americans who are willing to work for healthcare and a salary. And I also want to remind those listening that I believe if you have your coverage kicking in on January 1st, you need to pay your premium before the end of the year, before January 1st, with most plans in the Affordable Care Act, which means the impact will be hitting you right now. I want to thank our panel and wish them happy holidays. This was a very good in-depth discussion. We took on some tough issues. I feel I understand things a lot better now. I also want to thank everyone who's tuned into these podcasts throughout the 2025. It's been really helpful. And I want to say let's hope for better things and better health in 2026. Thank you all. It's been a pleasure to share
Thank
this time.
you.
Thank you, and thank you for the work you're doing.
Thank
Thank
you.
you for having us.
On behalf of Protect Our Care, I'm John Simoes. Thanks for tuning in.